Hi everybody, Dr. Bryton here for Tooth Tip Tuesday. Today we're going to be talking about dental x-rays. So a lot of people have questions about dental x-rays. Why do we take them? What is it doing to me? So I want to address some of those things. So first things first, why do we take dental x-rays? One, I don't have x-ray vision. So I can't see the spaces between your teeth. I can't see the spaces below your gums. And so we take them so we can see those things. Big picture, why do we take x-rays once a year? We take them once a year because it takes about 12 to 24 months for a cavity to form. And so we want to make sure that we're taking an x-ray to evaluate the spaces that we can't see with the visible eye once every 12 months to make sure that nothing's starting in there or nothing has started so that we don't let disease progress. Now, some of those images that we take once every 5 years, kind of the bigger images, panoramic x-ray or a full series of x-rays, or the cone beam CT scan that we have, the 3D imaging that we take once every 5 years. Those are used to evaluate the jawbone, the teeth, but allows us to evaluate for things like tumors, cancers. And so that's why we take those once every 5 years. Now, in addition to that, we also take x-rays for symptomatic teeth. So if we come in, we got a toothache, we want to make sure we image it, see what's going on with it, see the nerve, see if there's something going on there. And then from there, before I ever treat a tooth, I'll take an x-ray of it. It gives me a roadmap. It allows me to see what I'm actually getting myself into. How far is the nerve from everything? The last thing you want to do is just a filling on a tooth per se, and then find out that the nerve actually had a problem. And so it's allowing you to see the big picture, where we'll look at the tip of the root all the way to the tip of the tooth, and we want to evaluate what's going on in there. Now, in addition to that, those bite wing x-rays we referred to earlier, those also allow us to look at the jawbone. And so they can give us some hints on the health of your jawbone and maybe even give us some insight as to maybe the progression of gum disease or the start of gum disease. And so it's somewhat multifaceted as to what it shows us. Now, a lot of people have questions as to how much radiation they get, and that's a great question. You should be asking that. First and foremost, modern digital x-rays have literally been created to minimize exposure as much as possible. And to just give you the kind of reference or relativity to it, when you walk around in a given day, you're given background radiation is what it's called. It's just part of living. And a typical dental x-ray will give you half the amount of radiation that you get from just living. Now, that being said too, if you had a banana this morning, you had some radiation with it. So there's some interesting kind of relativities there. For instance, you took a flight today, you went somewhere. Depending on where you went, you got a good amount of radiation there. It doesn't mean it's bad for you, it just means you got radiation. And I tell patients that actually our cone beam CT, the 3D imaging, has about the same as a typical airline flight. Now, if you went a long distance, you may have actually got more radiation than what you get with a CT scan. So kind of puts things into perspective there. Things nowadays, with the way they've been modernized, the amount of radiation is quite low. Now, in addition to that, it's also my responsibility to give you as little radiation as possible. So we're not just taking x-rays to take x-rays. We take them if we need them, and the actual positivity from it outweighs the risk of it. And so that's radiation that you get relative to the x-rays and kind of puts things into perspective. But I hope that also explains dental x-rays a little bit more to you, why we do them, what they're needed for. So hopefully that's helpful. If you have questions about that, please comment below. We'd love to respond to you, help you out with that, or you can call us. But like us, share it if you think you can help somebody. We'd love that as well. Hope you have a great rest of your week. Thank you so much for tuning in. Have a great day.